Dr. Wendy Wagner, lifetime OBGYN, and today's segment is on birth control pills. I thought I would go over some myths about birth control pills, some truths about birth control pills, and directions on how to take them. Okay, first of all, some basics on birth control pills. What we call combined birth control pills all have estrogen and progesterone. The estrogen is always the same, so every single birth control has the same amount of, or same type of estrogen in it, sometimes in different levels. The difference in birth control pills is in the amount of that estrogen and the type of progesterone. So in the old days, we used to have 50 microgram of estrogen pills, very high dose, lots of side effects, and a lot of the myths I'm going to talk about have to do with that. Weight gain, stroke, things like that. Now the estrogen level has come down. Most common pills are 20 micrograms, and now we have pills that are down to 10 micrograms. As you would imagine, with the decrease in the estrogen, there's a lot less side effects. The other thing that's in it is the progesterone. There's different types of progesterone, and that's going to give you different types of side effects. So if you have side effects with a certain pill, there's lots of other pills that are options to switch around to. In general, the birth control pills are 4 weeks, which is 28 days. Okay? Usually you'll see packs in rows of 4 weeks with either the last 7 or the last 4 days is what we call placebo or sugar pills. Some pills have a circle, and so it starts here, it goes all the way around, and the last 7 days, again, is the placebo pill. Okay, myth number 1, weight gain. Not true. Again, when we were talking about pills that are 3 or 4 times higher level of estrogen, might have been the case. Tons of studies done. Birth control pills at the levels that they are today do not cause weight gain. There might be a pound or 2 of water weight that people gain a little bit and then lose again, but the only way that weight gain will happen is if the pill increases your hunger and you're eating more. Now this does happen occasionally to people, and if that's the case, you think about a different method of birth control. But the pill in and of itself does not cause weight gain. Another myth or fear that people have is that the birth control pill is going to cause stroke. There are certain people that shouldn't take the birth control pill, people with high blood pressure, heavy smokers over the age of 35, and potentially people with some issues, strong family history of stroke. Now the baseline risk of stroke without use of birth control pills is low. 100,000 people, 15. It does increase with the pill, but it's still very low. 100,000 people, only 60 of them would have a stroke. So this is very, very low risk if you don't have any risk factors. Another big one that I hear all the time is if I'm on the birth control for a long time, I'm not going to be able to get pregnant. Absolutely untrue. Fertility should come back in about a month, and it's not going to be any less than it was before. There's no impact on fertility. The pill is out of your system quickly, and there'll be no changes. The way the birth control pill works is by stopping you from ovulating. If anything, that will help in the future decrease things like ovarian cancer, endometrial cancer, things like that. That's more than we need to go into today, but as far as these myths go, no, slight increase of this, but if you're low risk, nothing to worry about, and infertility, absolutely not. Alright, here's some truths about birth control pills. Many, many times birth control pills are used for things other than birth control. People that don't have regular periods or have heavy or painful periods, the birth control pill will lighten your period, sometimes to the point of, with some pills, not having a period. Less painful. It regulates periods. Some people who don't get periods or get irregular periods, the birth control pill will make it come essentially every 28 days. It also decreases your risk over time of ovarian and endometrial cancer because of the way it works. Now, side effects of birth control pills, even though it's a really good method of birth control and it's good for other reasons, there are side effects. I want to stress that everyone should try to take the birth control for 2 to 3 cycles, okay? Because that's when any side effects are going to go away. If you take the birth control pill for 2 weeks and then jump over to another type, you're not going to know whether these are going to go away. Some people do get breast tenderness with the birth control pill. That usually does go away in a couple of months. However, decreasing caffeine intake and things like that are definitely going to help. Spotting, first 2 or 3 cycles, again, people can have mid-cycle spotting, and it's nothing to be concerned about. It doesn't mean that the birth control pill is less effective, but it should go away after that. Nausea. Some people do have nausea with the pill. A good thing to do is to take it at night, possibly take it with food so that is decreased. Again, broken record, wait 2 or 3 cycles. As far as headaches go, some people do get headaches with the pill. This is something to be careful with if you do have a migraine with an aura. So in other words, light sensitivity, if you know that you're going to get the headaches, if you have a history of migraines, this might not be the right birth control for you, so definitely call your provider. Even though mood changes aren't very common with the pill, some people do feel like they get some depression with it. If this continues after 2 to 3 cycles, you might want to change the method of birth control or just change to a different pill. In other words, a different progesterone or a different level of estrogen. Missed periods. So some people do get missed periods, especially with the low dose pills. Some people love this, they don't need to worry about it. Some people are nervous about this because they feel like they may be pregnant. No birth control pill is 100%, so if you do get missed periods and you don't like it, there's lots of pills that you can switch around to. Okay, so there's 2 ways that you can start the pill. The classic way was to start the Sunday after your period. So say you get your period on Friday, you would start the pill that Sunday and take it Sunday to Sunday. A month later you would start on a Sunday. The way that I usually have people take it is to start on the first day of their period. So the next period you get, first day of bright red bleeding, you start the pill. Okay, so the way to take the pill, and we saw that there's a bunch of different possible packs, is say you're taking it and you're starting on a Thursday. So you're going to take out the little sticker. You're going to be a Thursday start. So every week is going to start on a Thursday. Okay, you pop the little pill out of the packet and you take it. Okay, the last 4 pills in this particular pack are placebo pills, so they don't have any active medicine in them, but you still should take them. Common question is, do you have to take the pill the same time every day? You don't necessarily have to take the pill the same time every day, but it really helps to get into a habit of attaching it to something, whether it's getting up, going to sleep, brushing your teeth. Some people have an alarm on their phone where you remember to take it every day. Absolutely most important thing about taking the pill is that you remember to take it every single day. And in a minute we'll talk about what to do if you miss a pill. Okay? So this particular pill, you take all the 4 weeks. You take this on a Wednesday, and then on the next day, which is a Thursday, you start the new pack. Okay? Okay. What to do if you miss a day. So, oh my gosh, it's Sunday. We missed Saturday. What are we going to do? Pop the 2 out and take them at the same time. If you do that, you should be absolutely fine no matter where it is in the pack. Say you realize it's Wednesday and you missed 3 pills. You may have some spotting because you missed these pills. However, what I would normally tell people to do is stop the pill and then the following Thursday, start over on the pack, use a backup method of birth control for that month. Okay? Some people will say to double up 2 days in a row, but I don't think that's very helpful. If you have questions about that and it's the first week of the pack, just call your provider's office and say, you know, I missed 2 days, now what do I do? Okay, so a couple of things. One is no birth control method is 100%, so you need to use a backup method of birth control for 2 reasons. One reason is that you don't want to get pregnant, that's why you're using the birth control pill, and the other reason is that the birth control pill does not protect against STDs, okay? So use condoms no matter what to protect yourself. If you're taking antibiotics or some types of anti-seizure medication, it may make the birth control pill less effective. So if your doctor puts you on an antibiotic or you start an anti-seizure medication, definitely call the provider that prescribed the birth control pill and see if it's going to be less effective so that you don't get pregnant.